Good afternoon. My name is Sergeant First Class Nelson Smith. I'm an Army healthcare recruiter in Columbia, South Carolina. Right now, we're going to talk about the Army Health Professional Scholarship Program, HPSP for short, and how it can help you accomplish some of your professional and or personal goals. So the scholarship can be applied to medical school, dental school, optometry school, clinical psychology, as well as some advanced nursing degrees and veterinary school. Right now, we're just going to talk about the medical school aspect of it and then what that looks like from start to finish. All right, so the scholarship will pay for your entire fees, tuition, anything that's required for the school in order for you to complete the program, it'll pay for. It'll reimburse for books as well as equipment that you'll have to buy in order to actually complete the program as well, in order to complete your degree. You'll also receive this during the entire time. So if you're applying for a 4-year scholarship, you'll receive it for all 4 years. We also offer 3, 2, and possibly even 1-year scholarships as well. There is no cap on this scholarship. So regardless of what school that you want to go to, this scholarship will pay for it. Whether if it's MD or DO schools, as long as it is within the United States and it is accredited. Those are the only two stipulations. So if you want to go to Johns Hopkins or Harvard, you can very well go. If you want to go to UCLA or if you want to go to Penn State, you can very well do that as well. All right. Now, with that being said, you'll receive those things while you're going through all your years of schooling. During that same time, you also receive a stipend. Right now, that stipend is $2,870. That stipend will be given to you for 10 and a half months. That stipend also gets adjusted every July due to inflation. That stipend is also taxable, right? So during that same time, during your first year, you also receive a $20,000 bonus. That bonus is also taxable, but you'll receive that within your first year, okay? Now, we talked about the monetary things that comes along with this scholarship. Now moving on a little bit more, we're going to talk about residency. So when you go through our scholarship program, then pretty much you'll match into one of our residencies that is within our hospitals. Now, there is no difference as far as the accreditation for our residency. All of our programs and residencies are accredited by the same institution that accredits every other hospital and residency that comes along that is within the match process. All right, so there's no difference in as far as that. Now, the biggest difference is that you'll have a higher chance at matching into your specialty of choice. So right now we have an 85% first choice specialty match rate. That is the average across all of our hospitals, okay? So virtually we have just about the same residencies that you'll find outside, so there's going to be no difference when it comes to that. Now, the biggest difference on top of obviously the higher match rate is once you actually graduate medical school, then you'll commission it as a captain in the Army. Now, with that being said, typically residents get paid first year PGY1. Typically get paid anywhere between maybe about $60 to maybe $65, $70,000, depending if you're on the higher end. Coming into this program, graduating PGY1 or coming in PGY1, you're going to be paid anywhere between $85 to about $115,000. Now, that's going to vary depending on where your residency is actually at because of the cost of living. Now, that pay is going to be broken down into 3 different things. Your first is going to be your basic pay. Your basic pay is just what you're going to receive just for being a captain in the Army, okay? That is going to be taxable. The other 2 pays, which is going to be your housing allowance and your food allowance, that is not taxable income. So with that being said, even though you are making that $85 to $115, you're only being taxed at the $61,000 rate, okay? While you're actively in residency, you also are not worrying about deployments or trainings or anything like that. You're in a student status. So with that being said, that is your time to learn the specialty that you are planning on learning, okay? So now we're going to talk, so we also have, as far as our locations of our residency, we have like 12 different locations for our residencies and fellowships. We also offer fellowships as well. So with that being said, we offer 12 different locations spread across from Hawaii to Maryland to Georgia to Texas to North Carolina. So with that being said, we have different locations. With our residencies also, we also do have partnership with your civilian residencies as well. So like Penn State, University of Chicago, University of Texas, some of those other different places. We also have partnerships with them where you'll pretty much go to their residencies, and then from there you'll pretty much just be paid by the Army during your residency. So you're still receiving that extra benefits that comes along with doing a residency in the military, but not actually doing it in the military. Okay. Now, so since we talked about the residency a little bit more, now we're gonna pretty much, a lot of students ask, hey, well, what does this look like while I'm currently in medical school, right? So with that being said, we're gonna kind of go through what happens pretty much from start to finish when it comes to actually starting medical school with this scholarship. Okay, so once you start medical school, depending on when you apply for the scholarship, you'll start receiving the money the first day, or even the first month of actually starting medical school. Okay, that's going to vary depending on kind of when you apply, and if you apply with enough time to get everything rolling initially once you start. Okay, once you actually start medical school, only requirement that you have for the Army is going to be your physical health assessment. So it's pretty much a yearly requirement that just goes over your standard health records, right? To say, hey, these are the issues that I have going on right now medically, and then you'll schedule a virtual appointment with a provider, and then whenever that happens, then they'll have a conversation with you, go through everything, and that is your requirement for the year in order to continue, make sure you receive your stipend, you receive your scholarship, and things like that. So while you're actively in medical school during your first year, you have no obligation, right? That is your only obligation. So while you're in medical school, you're solely focusing on pretty much completing your first year of medical school. Okay, so from July or August or whenever that starts, pretty much rolling around to the end of your first year, you're solely focused on medical school. Now, basic training is not required for this program, but during the other 45 days of the year where you're not receiving that stipend, you're going to receive active duty pay. So because even though basic training is not required, there are two trainings that are. One is called Direct Commissioning Course. That one is in Fort Sill, Oklahoma. That one's going to teach you the basics of the Army. When it comes to personnel that may have been in for like 4 years, it's going to teach you those basics, right? So how to wear a uniform, custom and courtesies, rank structure, things like that. So that one will be in Oklahoma. Once you complete that class, then you'll pretty much go on to Basic Officer Leadership Course. That one is in San Antonio. Pretty much once you go there, it's going to be a 3-week class, and then that's going to be done on Fort Sam Houston or Joint Base San Antonio. You'll pretty much wake up, work out, go to class, get out of class. If you want to go and enjoy San Antonio, you can very well do that because your time is your time. Now, once you just got to make sure you're there the following day where you got to be working out with the rest of your group, okay? Once you complete those two trainings are typically done in between your first and second year of medical school. That's where that 45 days kind of come in because that encompasses that training. Now, if any point you cannot fit that within your schedule, within your school schedule, you'll talk to your HPSP advisor to say, hey, this is something that I can't necessarily do with this time because of my current school schedule. So with that being said, you'll work with them, you'll work out a time to pretty much complete that. Now, this scholarship can be applied to medical school or DO schools. So MDs or DOs, it doesn't matter which one, this scholarship will pretty much pay for it. So you'll do that typically you'll do those two trainings typically after your first year. Then once you start your second year, pretty much goes back into it. You'll do your physical health assessment, the virtual medical physical that you'll do, and then you'll pretty much go and complete your second year. Go through your second year, same thing, solely focus on medical school. Once you complete your second year, obviously you'll have to take your STEP exam, so your USMLE or your COMLEX Step 1. You'll pretty much do that, and then after your second year, typically your 45 days, you'll most likely be paid to study in place because your COMLEX and your USMLE exam is going to be a vital exam in order for you to start your clerkship during your third year. So with that being said, that 45 days, typically you'll be paid to study in place to make sure that you can pass that exam. Okay? Now, once you complete that, you'll start your third year, you'll do your rotations with your medical school, same thing, physical health assessment, that's completed, good to go. Now you solely focus on your medical school. Once you get through your third year, during your summertime after your third year, that 45 days, the Army's going to pay for it to send you to one location for your residency rotation. So you choose whatever residency, whatever location you want to go to, the Army's going to send you there. You'll do that 6 weeks. You'll make the best impression that you can, so that way say, hey, this is definitely where I want to go. Then at that point, you'll make that impression, and then you'll start your application for your match. Now, the biggest difference as far as your 4th year when it comes to what you're going to see going through this program versus your standard medical student is that our personnel match during December timeframe. So that 45 days that you have after your 3rd year is going to be vital when it comes to your match application. Okay, so you'll match in December before everybody going through your standard medical school process matches. So you'll find out far ahead of advance of everybody else. So that way you can make the correct coordinations and plan and kind of get everything rolling with that. So once you do that, you'll match, and then pretty much you'll complete whatever other requirements that you have for your medical school in order to graduate. Okay. Now, once you graduate medical school, you already know where you're going, and then at that point, you'll report to your residency. Now, while you're actively in medical school, we already talked about it while you're actively in residency, once you graduate, then you'll pretty much promote to captain. Okay. Once you promote to captain, you'll report to your residency, and then at that point, that'll be day 1 of your residency. Now, when it comes to that, your time there is going to be protected from any specific trainings or any type of any out area trainings or any deployments or anything like that, because you're in a student status. So we got to make sure that you have the time that's necessary in order to learn the specialty and learn your profession that you matched into. Okay. Now, with that being said, depending on how long your residency is, that's pretty much the time that you're protected. So even though we're going to talk about a little bit of the obligation afterwards, but that's kind of what it looks like from during your residency. Okay, so you'll pretty much do the same thing that you'll typically see outside the military and the residencies, with just a little bit added on to that military portion of it. But that specialty that you have, that training that you're doing, is going to be number 1 priority. So that's going to be the main focus. So once you pretty much complete your residency, then you'll graduate, and then you'll pretty much be an attending physician. Now, the benefits that comes along with that residency, of top of the pay that comes, the extra pay that comes along with it. So whenever you go into your residency, you'll be promoted to captain, and then typically residents get paid anywhere between $60 to $65 to maybe $70,000 a year, depending on the location. So through our residency, our personnel that's PGY1 is pretty much being paid anywhere between $84 to about $115,000. And the reason why you are being paid that much is because of the fact that you are being paid pretty much what you are being paid as an officer in the Army. So that pay is going to be broken up into 4 different things. Four different things. Your first one's going to be your basic pay. That's going to be about $61,000, and then you also get internship pay, which is going to be about $100 a month. Those 2 are pretty much taxable. Your other 2 is going to be your housing allowance and your food allowance. So those are non-taxable income. So even though you're making anywhere between $84,000 to $115,000 a year, you're only being taxed at the $61,000 rate, because that is what your taxable income is. Okay. So once you pretty much go through that, then pretty much you'll receive all of those payments while you're actively in residency. And another good thing about it is that the Army is we're not just gonna train you up, let's go ahead and get you there and you're trained, now it's on you to pass your board exam. No, the Army is going to continue to work with you to make sure that you can pass that board exam first time go. Okay, right now we have a 96% first time pass rate on all board exams following residency. Okay, now I talked about it before, but we do have fellowships within the Army as well, within our facilities, and then you could possibly do a residency outside the Army as well, depending on, or a fellowship outside the Army as well, depending on which one you're planning on going into. Okay, so now we talked about kind of what it looks like from start to finish for medical school, and then what it looks like start to finish for residency. Now we're going to talk about the requirements. So basic requirements for the scholarship is going to be a 3.2 GPA, and then also a 500 on the MCAT with at least 124 in each line score. Those are going to be the basic requirements There are waivers that are available, but it's just going to kind of depend. But there is no extra requirement on the applicant if they are looking to apply in order to obtain one of those waivers that are available. Another thing that comes along with it is a health assessment. So you will have to do a medical physical in order to kind of go through the process of making sure that you are healthy enough to join the Army. So those are the big things when it comes to actually applying for this scholarship and the requirements. So obligation looks like this. People say, hey, well, okay, this sounds too good to be true. Okay, well, what's the catch, right? There's no catch. There is a requirement, but there's no catch. So with that being said, the obligation is going to be year for year. So the year for year is going to be for either your scholarship or your residency, whichever one is longer. So if you take a 4-year scholarship and you say, hey, I want to do, let's say, family medicine, right? And then family medicine is only a 3-year residency, then your obligation is going to be 4 years because of the fact of you taking the 4-year scholarship. Now, if you say, hey, took a 4-year scholarship, but now I want to do a surgical residency like orthopedic surgery, general surgery, things like that, then at that point, because that residency is 5 years, now your obligation reverts to the longer portion of it, which is the 5-year obligation. Now, the only caveat to that is for any personnel that are applying for 3-year scholarships. If you are applying for a 3-year scholarship, but you take the bonus, then at that point, the obligation at minimum is going to be 4 years. That is not 4 years added on top. That is 4-year active duty obligation afterwards. Okay. Now, with that being said, that is the obligation. It is not added to. It is not the residency and the scholarship obligation added together. It is whichever one is longer. Okay. Just want to make sure we dispel any of those myths that's out there that says, hey, well, it's added together for my active duty. No, that is not true at all. Now, I will tell you that there is an mandatory military obligation that comes along with any branch in the military, and that obligation is going to be an 8-year obligation. So that 8-year obligation looks like this. The active duty obligation that you have from the scholarship pretty much is your active duty obligation. That is what you have to serve active duty in the Army working as a physician at one of our facilities. Any extra time leading up to that 8-year point, that is going to be your inactive ready reserve. So what that means is that you do your active duty obligation, you get out of the Army, you're living your life, you go home, you're working in a facility, or even you have your own practice, right? And then at that point, anything leading up to the 8-year point, if at any point World War 15 kicks off, or we need a specific physician in the Army, then at that point they can call you up to say, hey, we need you to come back in, or hey, do you want to come back in because of the fact that we need you for this or this, right? And then at that point, then you come back in or not come back in, and then at that point, that's when you'll come back in to pretty much do your specific job. You're not kicking down no doors, you're not breaching any buildings, you're not doing any of that. Your job is going to be your job. Now, if you're active duty Army, you want to go jump out of planes and get airborne and air assault and work with special forces, that's definitely a possibility. No one's trying to necessarily limit you, but most physicians don't necessarily want to do it. But if you want to, it's very well possible. Okay, so that's what that obligation looks like. Now, let's say, hey, you say, yes, this is something I maybe want to explore. Then, hey, this is something I want to do. Then what we would do is that we would schedule a time for you to come into the office, or we can do it virtually. No issues. We can process personnel throughout the entire nation. You say, hey, this is something I want to do. Then at that point, we say, okay, well, let's schedule a time, have a conversation. We'll get everything settled. Initial conversation or meeting will pretty much give you access to the online application. We'll collect some source documents, i.e. maybe some transcripts, MCAT scores, things like that. And at that point, we'll schedule a time to get your physical completed. So that medical physical that we talked about before, that's going to be required for anyone currently going through, unless you are a currently serving officer, okay, in the military. Now, with that being said, once that's completed, we'll give you access to it. You'll fill out everything online. Honestly speaking, this process does not take an extremely long time. Sometimes it takes a little bit longer because they're working around student schedules and things like that, because they're currently in school, right, or currently in medical school, undergrad or medical school, or they're currently have a job or things like that. So because we're working around their schedule, we can get it completed in as little as maybe 2 to 3 weeks, or it can take 2 to 3 months. Just kind of depend on that applicant's schedule. Okay, now once the physical is completed, we'll get everything within the system. We'll pull documents. We'll have you do some fingerprints, have you sign some documents. All the initial documents are going to be statement of understanding documents. Nothing is going to be binding you to the Army, because of the fact that going through our side of recruiting, you have to be selected. Okay. Once you are selected, you can actually apply and actually get awarded a scholarship before you even receive your letter of acceptance. So that is a possibility, as long as you meet those minimum acceptance criteria, that 3.2 GPA, as well as that MCAT of 500 with at least 124 in each subsection. So it is possible to receive the scholarship conditionally before you actually receive your letter of acceptance. And then at that point, we just have to make sure you get a letter of acceptance. Okay. So once you receive your letter of acceptance and you get accepted for the scholarship, then at that point, that's when we're going to do the last documents to actually put you into the Army. That's where you're getting commission and say, hey, I will support and defend the Constitution of the United States, right, and all of that greatness. So with that being said, that's when you're actually in the Army. Now, the earlier on within your application cycle that you do this, the better chances you have at actually getting the scholarship. And the reasoning why is because the Army does a rolling acceptance for all of our HPSP scholarships for medical school. So with that being said, the earlier on you apply, the better chances you have at actually getting the scholarship. So once you actually complete everything, you're awarded the scholarship, you commission, everything set, all we're doing at that point is literally just setting everything up and waiting for you to start medical school. So if you are applying earlier on in like September, October, December timeframe, you receive your letter of acceptance during that same time, then at that point, there shouldn't be any issues with you receiving everything at the time you're supposed to receive it. Now, if you're applying a little bit later in April, May, June timeframe, then it's going to take a little bit longer, because it takes a little bit of time in order to get everything running. Now, I will tell you that if you are applying for the scholarship, you are awarded the scholarship, the Army's going to send that check regardless, because of the fact that you have an obligation tied to it. So if any point you receive a scholarship from an outside source, there is a possibility that you could be refunded that, but that's going to kind of depend on that specific scholarship and if that scholarship is refundable. But like I said before, if you are tied to the scholarship through the Army's going to send that check in order to pay for your tuition. Okay. Now, we talked about a whole bunch of things that comes along with this scholarship. So, me honestly speaking, I truly believe this scholarship is honestly one of the best programs that the Army actually has. And I'm not just talking about it because I'm a recruiter. I am a combat medic by trade, so I'm not foreign to the Army Medical Department. And me just knowing what this scholarship actually can help personnel achieve, whether if it's not having to pay for your student loans afterwards, right? Now you're not $300,000, $400,000, $500,000 in student loan debt, because that debt is completely gone because you don't have it from your doctorate degree. Okay, whether if it's that or not having to pay for malpractice insurance while you're currently in the Army, or if it's just, hey, like I have health insurance for me and my family, and I don't necessarily have to pay anything out of pocket for it. Right, so those are some of the benefits that comes along with it, as well as having a 30-day paid vacation, and then also having that time to possibly become a leader and not necessarily just be a clinician. Right, you can take some of those leadership roles if you choose to do so. Right, and then also just treating patients that need to be treated. Because of the personnel, because of the population that you're typically treating here, whatever that patient needs, that patient's going to get. Because you are the subject matter expert that is tied to that specific patient. So if we cannot do it within that specific facility, because all of our facilities have different levels, right? We have a trauma level 1 all the way down to trauma level 3 or 4, right? So with that being said, if that facility cannot provide that specific service, then we'll find a location that can within the area. Okay, so that's kind of what that looks like from start to finish. So I'm happy that you've been able to sit through this conversation, this briefing, just kind of talking about what that looks like from start to finish. Like I said, this scholarship can be applied to 4-year all the way down to a possible 1-year scholarship as well. There's many different reasons why some personnel actually apply for the scholarship. Some are, hey, I don't want to have that $4, $5, or even $300,000 student loan debt that comes along with accomplishing the goals that I set for myself. Well, let the Army kind of take that burden off of your hands, so that way you can solely focus on the things that you have to focus on in order to be the best position that you can be. Okay, so I'm going to put my information down below, but I'm going to talk about it as well. So if you have any questions about the scholarship, or even wanted to apply, or talk to any currently serving physicians in the Army, or even want to talk to someone that's currently going through this program in one of the medical schools, then we can go ahead and get you in contact with those personnel to get it directly from their mouths of how their experience was, and kind of what it looks like, and what does day-to-day Army look like as a standing physician, or even as a medical student, or even as a resident, right? We can definitely get you in contact with those personnel, so that way they can give you their story on how their journey has been and how they got to where they are now. So if you have any questions at all, you can comment below, or you can give me a call or a text at 803-457-0432, or you can also give the station, right, our recruiting station, a call at 803-234-2072. You can also send me an email at Nelson, that's NELSON .C as in Charlie .Smith, that's SMITH .mil, that's MIL at Army.mil, MIL. That's Nelson.C.Smith13.mil at Army.mil. I appreciate you sitting through my briefing, my conversation about the scholarship, and I hope that this scholarship can very well help you accomplish some of your goals. Thank you for listening. Bye.